you feel that it's a physician giving away of power in terms of autonomy,
Definitely.
particularly when we're dependent on the vast capital resources of these larger hospitals and organizations, and yet once we're in that setting, once we're employed, we have a different or even a lesser voice in terms of where our practice is going.
Definitely. I've seen various stages of this happen. I've entered into different businesses across Texas at different stages of this process, where the particular practice is in the process of becoming incorporated into a different business or hospital. And right now, I'm working with a woman who has her own practice that is now becoming incorporated into a large group. And it's sad because it started out as her own doctor-owned facility, which is now becoming under the umbrella. And watching her, she's a good friend of mine, and watching her go through the process of becoming incorporated, and I know what's coming down the road, and I'm just trying to slowly break it to her. And what happens is, all the time and love and investment that she put into putting this company together, it's handpicking the different employees that work there, and designing the facility and designing the flow of the business and how it should work, and then watching it slowly become the corporation down to, how her practice is now run by the company instead of by her. And her era is it's not going to be her era anymore. It's now becoming theirs, to the point where she can't even take a Friday off to go to a conference. She has to get permission. And this is her place that had her name on it. They took her name off, and it is now somebody else's. And she was, just grieving the fact that one of her patients, she went through cancer with this patient, the mastectomy, the chemo, the radiation, the implants, everything with this patient, who now has to come in, and there are now 10 forms where there used to be 3 forms. They had to wait, and before they could do the ultrasound, they had to get the request from the physician first. And there was another, 45-minute wait for that request to come in before they could do it. And now the fee for it, whereas before it was a certain amount, the fee just to do this, the exam is now in the hundreds of dollars. It's totally changed the face of the practice.